Hello, in this FERNE presentation, we will address the treatment of emergency departments who present with dizziness and vertigo, attempting to successfully diagnose and treat serious central etiologies. My name is Edward Sloan. I'm an emergency physician in Chicago, and I've served as the FERNE president and board chair for 3 decades. I have no financial conflicts. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo, and please follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, FERNE.org. So in part 3 of the ATTEST clinical pathway, we will address episodic vertigo, specifically in this case, the episodic vertigo that is spontaneous and not triggered. So this comes from the timing and triggers approach to the patient with dizziness, published by EB Medicine, written by Jonathan Edlow. This is a great monograph written by this physician. And we are looking at part 3 of this clinical pathway for the ATTEST approach to ED patients with dizziness and vertigo. In this case, we're saying, okay, if it's not constant and persistent at the time of evaluation, then it is triggerable. And if the question is it triggerable repeatedly? And if the answer is no, then it appears to be spontaneous episodic vestibular syndrome, either caused by a vestibular migraine or TIA. It's seen here with the red star and those decision trees circled in yellow. So, spontaneous episodic vestibular syndrome. If you say there's no likely medical cause, and or if there's some possible worrisome nystagmus, we then ask just a simple question, is this symptom of vertigo continuous and present? If the answer is no, then you ask, is it triggered by head movement or standing? If the answer is no, then the diagnosis is spontaneous episodic vestibular syndrome, s-EVS, in which case it can be caused by Meniere's disease, vestibular migraine, a cardiac dysrhythmia, and highlighted in yellow, posterior circulation TIA. So this is the most important central etiology to the cause of spontaneous episodic vestibular syndrome. So this part 3 of ATTEST asks whether or not the vertigo is spontaneous or triggered, and if it's spontaneous, we must consider the fact that it could be related to a posterior circulation TIA. If you have questions or comments related to this content, please get a hold of us at fern.org at gmail.com. We look forward to hearing from you at any time. Have a good day. Thank you.